Hello, hi everybody. How's everyone doing today? Assalamualaikum. Today we are going to be talking about a very timely subject because it's October and it's regarding breast cancer month. Okay, there you are. Regarding breast cancer month in October, so about mastectomy. If you're not sure what that is actually breast surgery. When someone has cancer and they have no other options but to remove their breast, that's called mastectomy. Sometimes it's single, one breast, ataupun it's double, two breasts. So after a mastectomy, apparently there are things that you can and cannot do, and there are also things that you have to do, macam exercises and whatnot. So let's talk to the expert of the day. Today we will be talking to Columbia Asia Hospital Setapak Physiotherapist, Puan Nur Izyan Osman. Assalamualaikum Puan, apa khabar?
Waalaikumsalam. Thank you for asking. I'm good. And how are you, Puan Sakina?
Alhamdulillah, I'm good also and very excited to hear what you have to say because topik ni tak apa ya, kita campur-campur cakap lah English and Malay because it's casual after all. Okay, topik ni because it's October, so it's a very special topic since October is breast cancer awareness month, yeah. So hari ni sebelum kita start kita punya Q&A, why not kita check what Puan Nur Izyan has to say about mastectomy. Apa sebenarnya mastectomy? Silakan Puan Nur Izyan.
Thank you, Puan Sakina. Hello, listener. I'm Nur Izyan. As Puan Sakina had mentioned today, we're going to talk about exercises after post-mastectomy. Okay, what is mastectomy? Mastectomy is a surgery to remove all the breast tissue from a breast as a way to treat or prevent cancer. Usually, there will be a drainage through your chest area, your surgery site, to drain out the blood.
Oh, okay. All right. So that's very brief. Okay. Then after that, what are some of the things that are expected after a mastectomy? Okay, we just assume that everybody is clear what a mastectomy is. Yeah. So pembedahan payudara. Is that right in Malay?
Betul.
Okay. So lepas tu, now kita punya topic today has to do with after the surgery. Apa akan berlaku selepas pembedahan? Okay. So we are going to be talking about what can we expect. Okay, Puan Izyan, maybe you can let us know apakah some of the things yang kita boleh what do we expect after the surgery? What is going to happen in terms of rehab dan sebagainya?
Alright, there will be a few expectation. Yang pertama, of course, pain and needles. Pain and numbness. You akan rasa macam feel pins and needles at your chest area at the time you have a surgery. So this feel pins and needles should be getting better as your nerves heal. Okay, it is important to keep moving even if you have some pain or numbness. Okay, the next one is swelling due to the poor blood circulation. Okay, poor positioning. After your surgery, you may have some swelling or puffiness dekat tangan, alright, and the arm of the surgery site. Okay, the next one is cording, Puan Sakina. You may feel thick cord, macam tali, which is under your skin and under your armpit that run down into your arm on the surgery site. Alright, so this sometimes a side effect of sentinel limb or axillary node dissection. This also will goes away over time. The next one is lymphedema. Lymphedema is a buildup of fluid and a body part caused by damage to your lymphatic system. Alright, so this also can be done with some exercises for hand circulatory exercise.
Right, I see. Okay, so that's what happens lah after a surgery. Okay, bagaimana dengan langkah-langkah rehab? What can we do in order to help? I mean, for us to know, okay, what is a rehab for post mastectomy? So we all, even sebagai caregiver pun kita kena tahu juga kan pasal all this can help the patient.
Okay, first and foremost, Puan Sakina, this is very important. You have to tackle the psychological or overcome the mindset of being feared. Sometimes patient or client, dia akan tanya, can we do this? Can we do that? Am I supposed to do this? Am I supposed to do that? Right, correct. So this is what the importance of rehabilitation post-mastectomy. We're gonna come to them, akan bagi tahu, okay, you can do this, okay, you must move, kena bergerak, kena buat some movement untuk melancarkan pengaliran darah dan untuk improvekan kita punya julat pergerakan. Okay, itu yang pertama. Yang kedua, prevent scar tissue from forming, right? Too many scar tissue will limit your movement afterward. Alright. The third one, improve the blood circulation just to reduce swelling. Alright. As we know, the blood vessel carries the oxygen, nutrient, which is this mechanism is very important to improve the healing process as well. And as I said mentioned earlier, increase range of motion, the julat pergerakan, dan untuk return to the normal activity as functional independent activity daily livings as soon as possible, Puan Sakinah.
Yes, of course. This daily living, for example, shall we take a look at what are some of the things yang has to do with daily living? Here we go. Okay, self-care. Maybe Puan Izyan can take us through one by one.
Okay, self-care, Puan Sakinah. It's like comb hair, eating, holding a mug untuk minum air, alright? Brush your teeth, that's what we call a self-care. Okay, all that movement, all that activity you can do even right after the mastectomy. Okay, the key word is do not rush. Everything that we did, you mungkin kena buat secara regularly, ada progression, jangan rushing sangat. Buat slowly saja. The next one is dressing. Okay, dressing adalah cara pakai baju. Okay, let's take for example the surgery side, which is on your left side. Okay, so how you wear your tops or your shirt. Nak pakai baju, wear from the affected side first. Okay, masukkan tangan from the affected side and then baru masuk dekat unaffected side. Same goes vice versa kalau kita nak wear off the shirt or tops. Keluarkan daripada unaffected first, which is on your punya right, and keluarkan on the left. Alright. The second tip is kalau untuk dressing, I suggest you to wear a loose top and a button shirt. So lagi senang rather than sarung. Alright.
Yes.
And then driving. Okay, when we talk about driving, honestly speaking, I'm not suggest you to drive as if you have taken any medication. If I prescribed by a doctor, ada medication sebab kita takut nanti there's a drowsiness. Okay.
Oh, I see. Yeah. It's not so much about the action lah, not the physical.
Yes, first is medication, the effect of medication. The second one is of course, if you have like return to your punya normal range of motion, the julat pergerakan, like you turn around, you can raise up your hand more than 90 degrees, then you can drive. But first and foremost, because of the medication. So you have the medication. Okay, next one is working. Okay, every person has very different tolerance of pain endurance. Okay, one must expect the recovery process a bit slow. One must expect the recovery a bit fast and quick. Alright. So working, kalau nak pulang balik waktu bekerja, that one you have to consult with your surgeon or your specialist untuk tahu sama ada dah boleh pergi kerja atau tidak. Selalunya akan ambil masa insyaAllah dalam 6 minggu.
About self-care, dressing dan driving, can pain be an indication tak that you cannot do that? For example, patutnya macam kalau takat brush teeth tu is okay lah agaknya, but then kalau dirasa sakit, does that mean that the body is telling you, oh wait, you cannot do this yet? In your experience, patients ada complain macam mana biasanya?
Okay, saya memegang satu statement, satu frasa. No pain, no gain. Tapi always your body. Always listen to your body. Okay, memanglah sakit tak baik. Tapi in the same time, you know your body very well. Alright. So if you know your body very well, you should know where is your limitation. Tapi for the first 2 weeks, I suggest not to lift up more than 5 kilos and raise more than 90 degrees, which is above head. Pergerakan above head.
Yeah. I see. That's actually a very good. Yang trickynya ialah when can the balance kan. No pain, no gain tu satu. Lepas tu listen to your body macam.
Yes.
Sebab people not sure what is the extent of both supaya dia selesa lah. Okay. But now I think this is the part yang kita nantikan because kita akan tonton satu video berkenaan dengan the demonstrations kan. Okay. Now we've got the exercises that is going to be demonstrated by, you have a model ke?
Tak ada, I model.
Oh, you're not the model. Okay, tak apa. We can take a look at who you are going to show today. Maybe you can explain to us first the exercises.
Boleh, sambil tu saya akan tunjuk the first exercise is deep breathing exercises. Okay, Puan Sakinah,
Okay.
this is very important exercise, deep breathing exercise, because it's promote relaxation and reduce
I see.
stress level. Okay, so selepas any reconstructive surgery and selepas any mastectomy ke, ada buat shoulder surgery ke apa, deep breathing exercises is very important. Okay, sebab kita nak lose our body. Kita nak relax our body. So deep breathing exercises senang saja. Letak kedua-dua tangan di antara dada dan perut. Tarik nafas ikut hidung dan hembus ikut mulut. Buat bentuk O. Tarik nafas. Ingat, do not shrug your shoulder. Do not lift your shoulder up. When you do deep breathing exercise, inhale through your nose and exhale through your mouth. And blow. Okay, we're going to repeat this like 3 to 5 times. Alright. The next one is neck gentle stretching and mobilization. Alright. Neck gentle stretching, I can say it's like move your neck side and side, which is kita akan tunjuk selepas ini. Move side to side. Okay, turn around. Yes, good. So every single of stretching, every single of movement, you must hold at least for 10 seconds. Okay, when we talk about stretching, hold for at least 10 seconds and repeat 3 to 5 times minimum. Alright. Same goes to shoulder gentle stretching and mobilization. The next one is scapular mobilization, which is you have to move your scapula. Kita punya shoulder blade, wings, our wings, alright. The fifth one is hand gentle stretching and mobilization, which is untuk reduce your punya puffiness. And the next one is functional independent activity, daily living activity. Yang itulah yang kita buat macam pakai tudung ke, comb your hair, brush your hair, something like that. Maybe we can go to the next slide.
Okay, alright.
Okay, Puan Sakinah, ini kita tengok pergerakan dia tidak melebihi 90 darjah. Slowly raise up your hands side. Alright, you may repeat this. This is for mobilization exercise. Same goes to this one. No more than 90 degree and open, close, open and close. Alright, do exercise secara slow and gentle. There's a principle in exercise. Kita tak boleh terlampau rush. When we do the exercise, slowly up and down, so that then we can see the effectiveness of the exercise. Slow, up and down. Same goes to this
Example
one.
ni kalau the surgery is on the left side or on the right side, kalau mengikut model ni.
Kalau model ni angkat tangan belah kanan, so the surgery side on the left, on the right side lah.
Oh, okay. It's the same side jugalah. Okay.
Yes, on the same side. Now open and close. This exercise you can do in sitting or you can do in lying as well. Okay, kalau you baring, kita angkat tangan pun boleh actually. It's just that if you feel a big stretch here, you do as much as you can. Okay, do not force any movement because this is exercise like for the first 2 weeks. So you have to do gently, slowly and always listen to your body. Okay.
Yeah. Kalau sakit, because I'm sure kadang-kadang macam tak comfortable agaknya sebab baru surgery kan?
Correct.
Okay. But listen to the expert lah. I will just leave it to you and the doctor to handle. But okay, what we are seeing now is what we should do. Yeah? Whether we can do or cannot, yang betul lah. Tapi lah. Okay. Alright. So the next one?
Okay, ini yang functional activity. Like we are combing our hair. Sikat rambut. Okay, sikat rambut. Alright. Any movement kalau perasan is not more than 90 degrees because this exercise is designed for the first 2 weeks. 2 minggu yang pertama. Sebab actually exercise will increase dia punya resistance and gradually increase dia punya range of motion. That what I mentioned earlier, the julat pergerakan. Okay, so that's why we suggest to not more than 90 degrees. Okay, so kita buat macam sikat rambut. Same thing, you can do this exercise is either you lying down, okay, ataupun duduk. Usually after the mastectomy, right, kita mereka akan dibiarkan dalam keadaan not more than 45 degrees lying down. So as early as you wake up, buka mata je, terus buat deep breathing exercise. As I said earlier, do exercise slow and gentle as much as you can sahaja. Like say lah, you cannot, as I said just now, 3 ke 5 kali. Alright. Tapi sangat tak boleh. Kalau sangat bangun tidur. You just like gently 1, 2 and relax. After some while, then continue again.
Alright. Okay.
Alright.
Okay, let's take a look at the next one.
Okay.
Ini apa pula?
Okay, ini dalam lie down. Okay, tengok ya, kita angkat tangan, bawa ke atas. Alright, if you can see, this is a example of one side of mastectomy. Okay, satu belah saja. Alright, so kata kita buat belah kanan, the mastectomy which is on the right side. Okay, the opposite side, the left hand side, assist on the right side untuk angkat ke atas. Kalau mula-mula. Alright, now this one inside. Okay, shoulder side movement. This is not suggest for both mastectomy, yang side to side, because it's going to put attention on the surgery side. And this one is modified by bicycle, kita bawa ke dada. Okay, now this one is open and close. Brings your elbow open, out and in, and this open your armpit. Okay. It might be a bit easy, tapi untuk mereka yang selepas mastectomy, ianya agak susah untuk dilakukan lah. Right? Okay, the next one is the hand secretary exercise. Okay, kalau kita ada ball, ada squeeze ball tu, pegang and hold 1, 2, 3, 4, 5 and slowly relax. This one is to improve the blood circulation daripada tangan kita back to the heart. Balik ke jantung. Squeeze 1, 2, 3, 4, 5 and relax. Okay. It's much better kalau you boleh tinggikan sedikit. Elevate your hand with one pillow or two pillow. Tinggikan sedikit and do like this one. Alright, squeeze and relax. Squeeze and relax.
Alright. What do we have here? The next one?
Okay, ini daripada side. Kita angkat ke depan. Not more than 90 degree, slow and gentle to the shoulder level. 1, 2, 3, yes. At least 3 to, for this mobilization, I suggest to like 8 to 10 times, except stretching. Right? I'm gonna teach you the stretching exercise after this.
Okay.
Ini daripada bahagian depan. Tadi kita angkat daripada bahagian depan. The next one. Okay. Ini shoulder circle exercise. Clockwise and anti-clockwise. Sama juga. Exercise senaman perlu dilakukan secara slow and gentle. Okay, maybe you can do 10 times clockwise and 10 times anti-clockwise. Alright, slow and if you feel pain, or feel not comfortable, you may rest. Right, always listen to your body. The same thing, no pain, no gain, but always listen to your body. Right?
Okay.
You know your body very well. Okay, yang ini, the next one is exercise. Yang ini selalunya kita akan buat selepas sekurang-kurangnya 2 minggu dan ke atas. Apabila dia punya scar, your scar has healed and the drain has been taken out. Alright, so kita akan buat movement above head. Okay, slide down, up, slide down. Okay, slowly atas dan ke bawah.
This exercise kan, Puan Izyan, if you have like a partner atau your caregiver, can your caregiver be the one to hold your hand up and down instead of using a wall, boleh ke?
Saya
Macam
lebih
bonding antara caregiver dengan patient.
Kalau saya, kita lebih suka guna kat wall lah. Better.
Guna kat wall lah, okay.
Kita nak ada, you are exercising. Kalau pakai orang tolong-tolakkan, seolah-olah ada benda yang untuk tolong. So when you do the exercise by yourself, using your own muscle, your own effort.
Yes.
Okay. Bila kita tolong pesakit atau kita tolong klien, nanti dia tak letak the muscle effort. So they don't know yes, either painful or not painful. Bila kita tolong, kalau kata apa-apa pun, bila kita tolong angkatkan, you akan rasa sakit, tapi it's not as bad as you angkat sendiri. Bila you angkat sendiri, you know, okay, this is your limitation. At least in the future, you can increase the julat panggang, the range of motion. Maybe for the first day, up like here. Maybe the second or third day, atas sedikit. But better for you to use your own muscle effort.
Yeah, they need the independence lah.
Yes, itu yang kita
Okay.
nak.
I see. All right. Okay. Before we go to the do's and don'ts, Puan Izyan, all the exercises that was demonstrated just now, maybe you can advise us, like, as a patient, how many times a day must they do all these exercises and how many sets? Because nampaknya yang the ones done sitting down tu looks very simple. So macam sambil-sambil tengok TV, can they just carry out those exercises?
Okay, alright. Saya cadangkan, I suggest to do this exercise at least like 3 times per day. Okay, 3 kali sehari. Tetapi, always listen to your body. Buat 3 kali sehari dan pagi, petang dan malam sebelum tidur. Itu satu. Yang kedua, untuk stretching, saya kaji juga selepas ini. Untuk stretching, macam saya kata, sekurang-kurangnya tahan untuk 10 saat, 10 second and repeat 3 to 5 times. Which is the other exercise like moving exercise, okay, mobilization exercise, iaitu kita cadangkan 8 hingga 10 kali, 8 to 10 times. 8 to 10 repetition, sorry. 8 to 10 repetition, alright. Untuk stretching adalah you hold. Pergerakan tu you hold pergerakan, you stretch your muscle. Itu adalah stretching. Pergerakan, you stretch your muscle. Same those like this one yang saya tunjuk tadi. Kita stretch, we're gonna feel a big stretch here. Macam full pain here. Okay, yang itu tahan untuk sekurang-kurangnya 10 saat dan ulang 3 ke 5 kali. Okay, untuk mobilization like macam tadi shoulder circle 1, 2, yang itu sekurang-kurangnya 8 hingga 10 kali. Am I clear?
Okay, yeah. So on average it's like 8 to 10 times per set lah, and then 3 sets a day. Pagi, tengah hari dan malam.
Always
Okay.
your body once again.
Sorry, say again?
Always listen to your body.
Always listen to your body. Okay, that's very good advice. Okay, what are we looking at now? Do's and don'ts ni, what this is all about?
Okay, as I mentioned just now, do not carry heavy weight more than 5 kilos for the first 2 or 3 weeks. Sebab they have a cut in your chest area, so
Yes.
there will be some difficulty. So rather than you carry, maybe you have to just push. If you have a trolley, you just push that way. Or over the counter, just slide down the counter. Kalau ada macam dekat atas meja, kalau rather than ambil daripada jauh, you just slide barang to over the counter. Alright. The next one, do not drive while you're taking the medication that cause drowsiness. This is what I mentioned earlier. We are not suggest you to drive, especially if you take any prescription by the doctor. Do not do any strenuous or aggressive activity. Okay. I can say like vacuuming, sweeping floor, itu kind of like activity yang tidak digalakkan dahulu for the first 2 weeks.
You use a lot of your arms kan when you do.
Yes, correct. Walaupun nampak simple, tapi sebab you nak push dia punya penyapu dengan mop lantai tu, sebenarnya ada resistant. So which is the first 2 weeks kita kalau boleh elakkan apa-apa resistant. Use your own body weight. Okay, there's no resistance. The next one, avoid to apply thermal things on your surgery site if you feel numb. Okay, just I mentioned, after the surgery you're gonna feel a pain and somehow ada numbness dekat sini. Alright, so dekat akan rasa kebas, numb. So please avoid like putting like hot pack or cold pack because we are preventing avoid any frostbite atau burning. Bila dah kebas, you not feel anything, isn't it? So, yes, perkara-perkara macam tu. Dia ada banyak do and don'ts, tapi you have to see the patient. So we gonna see the patient. Kalau still dalam ward, we have to see the patient every day. Okay, we are the one gonna say this is your limitation. We can suggest the patient what kind of exercises that we can add up more. Because exercises, a lot of exercises. Cuma kita kena tengok keadaan pesakit juga dekat dia punya pain endurance and pain threshold.
Yeah. Okay, Puan Izyan, thank you so much for that very interesting explanation about exercises for a patient who has had mastectomy. Maybe you can also relate to some of your personal experiences. Macam what have you seen in the past? How long does it take for a patient to recover? Yang paling cepat you pernah nampak, ataupun kalau lambat tu, what are the mistakes that the patient has done in the past? Maybe because she doesn't have a maid, so she has to do everything herself, she has to carry the baby. So maybe she needs a bit of support. So before we wrap up the talk, any advice that you want to to say based on what you have seen in the past regarding this topic?
Okay. Alright, my point of view untuk kes-kes macam ni, alright, especially kena angkat baby, tak ada maid and something like that kan.
Yeah.
Make sure you must have a rest. You should have a me time, okay? You have to rest. Badan perlukan masa untuk berehat in order to heal the scar tissue. Alright? And then you have to modify anything like kerja-kerja seperti nak sapu habuk. Right now we have a lot of appliance yang boleh dimodify. Instead of pakai bulu ayam, you can use like a higher dustpan untuk bersihkan. Alright?
Right.
Yes, and keep a good posture. The good posture jangan hunchback. Sebab put tension on the surgery side. So open the chest, legs. A good posture. Okay, ini bukan untuk surgery saja. Kalau a good posture untuk the whole body kita. Alright. The next one saya nak cadangkan untuk angkat-angkat barang. Right? Untuk angkat barang, please use your body mechanic. Instead of angkat barang dekat atas lantai, instead of you hunchback and angkat macam tu, you better kneel down or squat down, bring that stuff or the things close to your body and get up slowly. Always listen to your body, get a good rest and maintain a good posture and body mechanic.
I see. Puan Izyan, maybe a few more examples about what body mechanics actually mean yang membantu patients, mastectomy patients.
Okay, body mechanics is moving your body in a way that will make doing this easier and safer. Body mechanics, katakan macam kita nak angkat baby. Okay, angkat baby ya. Squat down, angkat baby. Bawa baby tu rapat ke dada. Dada you angkat macam ni jauh-jauh. So bring the baby close to your body and get up. Okay. Lepas tu body mechanic, bila nak basuh pinggan ke washing dishes dekat sinki, okay, kita tends to hunchback. Alright. So it's, for me, letak a small stool dekat kaki, so that satu kaki dekat atas stool, satu kaki of course untuk berdiri. Waktu tu you just make your body straight and basuh. Yang ini you have to modify the sinki something lah untuk that, so you don't hunchback macam tu.
I see.
Kalau you are going out for buying a groceries, instead of trolley, tolak saja. Jangan tarik daripada belakang. Nampak you put tension. Okay, you always try for surgery side. So instead of tarik, pull, you put depan.
I see. Okay, so that sounds very practical. Kind of all the smart things that you can do is so that you don't have to exert yourself with all this unnecessary movement, especially when you are recovering from your mastectomy. Okay, anything else that you would like to share with us, Puan Izyan, before we wrap up the show?
So far, I think maybe can I share about the scar massage? Scar massage?
Can, of course, yes. We've got a lot of time. We can do that.
All right.
In the meantime, any one of you out there, if you have any questions, you can always type your questions in the comment section. Puan Nur Izyan is here to answer live. Okay, Puan Izyan, as you were saying something about scars, caring for scars.
Okay, scar massage. Very simple. I'm just demonstrate dekat badan sendiri. Just imagine there's a cut here, alright, dekat sini, which is after 2 or 3 weeks, insyaAllah the scar will heal. Okay, so ada cut dekat sini. All you have to do, okay, you might use a oil or lotion, but I suggest you to ask the surgeon or specialist or your doctors in charge sama ada this kind of lotion practical ataupun selamat untuk digunakan atau tidak, especially kalau ada mereka yang ada radiation therapy. Okay, some of the ointments or lotion is not suitable, so that's why you have to ask your surgeon whether it's safe or not. But all you have to do this one, there's a zigzag and circular movement. You use like 2 or 3 fingers, right? Dekat scar ni, bukan betul-betul atas scar, dekat side of the scar. Okay, pusing dahulu dekat tepi-tepi. Okay, this is your scar. So, alright, pusing di atas dulu in the circular movement. Okay, then ke bawah, alright. Bila dah betul-betul cantik, then you can massage on the scar. Alright.
Tampu ke? Will it not damage or will it not injure?
Sebab tu dia akan 3 weeks. Selepas
Oh, I
2
see. Okay, you have to wait up.
yes, sebab
Alright.
kadang ada still ada drainage, memang tak boleh nak buat lagi. Okay.
Yalah,
So after the scar has healed, you can start the scar massage. Okay. Nanti ada
Okay,
some
bila
of
dia dah kering sikit lah.
yes, correct. Sebab tapi lotion or ointment you have to ask your surgeon whether it's safe or not to use. Okay. That one is
Yeah.
circle movement. The next one is zigzag. Same thing. Okay, this is a scar. So all you have to do is like doing like zigzag, up, down, up, down, up, down. Bawah pun sama, the below side of the scar, up and down. Okay, bila dah okay, then on the scar, on top of the scar, zigzag. Right? The two type of scar massage you can apply right after the post mastectomy.
What
Right?
does that do? What's the benefit of that for the scar?
Okay, if you
When you have all those movements,
like, to prevent scar tissue from forming. Okay, this is scar tissue, all right. If the scar is too hard or thickened, bila you nak angkat tak boleh because of the difficulty. It's like stretch the skin.
Right. Yes.
Yeah, so tightness and pull pain here.
Yeah.
Okay, so that's why as the scar has healed, you terus boleh buat scar tissue massage.
Yes. And you need the skin to be pliable lah, because there are so many things that you need to do kan keras pula kat situ, susah nak stretch.
Betul, itu akan menyebabkan scar tissue adhesion. Itu yang menyebabkan some of the movement kita tak boleh buat. Tapi sebenarnya kita boleh. The scar tissue adhesion yang menyebabkan your punya movement akan restrict, akan terhad. Okay. Supposedly after mastectomy you can just return to your normal activity as usual. Tak ada masalah sebenarnya. It's just that you just have to masa untuk recover dan buat activity gradually and secara selamat.
So that's why it's very very important as we heard just now from Puan Nur Izyan, post mastectomy rehabilitation is very very important because it helps you after that kan, when kalau dah keras yang you kata tadi pasal if you don't massage the scar, nanti the skin will tighten, then it will affect your daily ongoings. So that's all Puan Nur Izyan punya advice tadi. If you have missed the beginning of this talk, you can always go back to Colony Asia Facebook, and the talk will be there for you to view in your own time. Yeah. Okay, so that's all the time that we have for today. We just had with us Puan Nur Izyan Osman from Colony Asia Hospital Setapak. She's a physiotherapist, and she was just talking about exercises and tips and advice about what you should and shouldn't do if you have just had mastectomy. Please do share the link with any one of your family or friends who have just had a mastectomy. I think this would be very, very helpful for them. Okay, thank you so much.
Thank you for Puan Sa. Thank you all listeners. Bye-bye.
Bye.